We sort of asked this question in a very simple way. These patients, T1 patients, have a very challenging cancer. I tend to see these folks at least 1 or 2 a week that show up with a T1 tumor. And I think the patients are now starting to get the sense that these are not very simple cancers that, you give a little bit of BCG to and they'll go away. These are pretty aggressive cancers, and I think the real concern here is that many of these are potentially muscle invasive cancers, and we know the overall survival, if you look at all comers, a third of them will not be alive at 3 years. 15% will die from bladder cancer. So is there any way, from a molecular perspective, you can look at these tumors and say, this is a bad actor? And that was really the question. So we compared the mutation profiles and really couldn't see anything. And I'll say that study is limited by the number of patients. We'd love to have more. We're studying that now. We have some funding to help look at that. So we're trying to look at that question. But the really exciting thing about that was that when you look at total mutation burden, and you saw that with Peter's talk and with Gary's talk, that total mutation burden mattered. That's neoantigens that it's reflecting. The responders, those who got BCG and responded, had a higher mutation burden than non-responders, which kind of goes along with the immunotherapy data that people with higher total mutation burden tend to be responders. Interestingly, because we had tumors at presentation and tumors at progression you actually lost total mutation burden. And so once again, we think that's an escape mechanism that the cancer is using when it comes back. It's dropping neoantigens, and that's kind of reflected in the TMB.